So, Dr. Park, thank you so much for joining me. I thought maybe we could just start by having you introduce yourself and what your role is.
All right, great. Well, thank you for inviting me, Dr. G. So I'm Christine Park. I'm the Director of Simulation at the Simulation and Integrative Learning Institute here at the Chicago campus. And my clinical role is an anesthesiologist.
Excellent. And the reason that I thought we could have a chat about this was really because our students are going to start their first TeleSim encounters during Block 5 in Docs. So I was hoping you could give us an introduction to what telesimulation is.
Yeah, sure. So we have two terms that we need to distinguish. One is telesimulation, as you already referred to, and the other would be simulation for telehealth. So telesimulation is really a replacement experience for the in-person experiential education. And so going into a telesimulation encounter, we're going to suspend some disbelief that we're not really together in person. And we're going to do our best to treat the encounter as if we were really there in person. By contrast, simulation for telehealth, the purpose for that is actually to practice all of the things that you need to be aware of for remote health experiences, including taking care of HIPAA requirements and other privacy issues and all those kinds of things.
Excellent. Just to wrap my brain a little bit more about what TeleSim would look like, do you think you could give us an example of, for our medical students, what a history and physical exam encounter would seem like to them?
Sure. So let's take simulation to start with. And let's imagine that I'm a learner and I'm about to perform a physical exam on you. And so if this were telesimulation, I'm going to do my best to treat this like an in-person encounter. So I would say, okay, ma'am, so I'm going to examine your abdomen now. So go ahead and lie down on the examination table. Let me get you covered up. I'm going to press in on the lower right side of your abdomen there, like this. I'm going to push in really hard. And now I'm going to let go. Did that hurt?
Got it. And then I would give a response as if I was a standardized patient.
Exactly. On the other hand, if I were a learner in a simulation for telehealth experience, now I'm going to accept that we're actually not together. And so I would say, okay, ma'am, so I want to get a better idea of the pain that's on your right lower side. So could you do me a favor? Could you just take both your hands and then press in on the right lower side, kind of near your hip bone? Press in really hard and now let go really fast. Tell me if that hurt.
Mm-hmm.
So does that make sense, that difference?
It makes sense. I'm actually thinking that for our students, as they're going to be thinking about doing these encounters, I feel like a good tip might be for them to just think out loud exactly what they would have said in the room to the patient and try to put themselves in that room as if they could. And whereas if they're doing simulation for telehealth, they are absolutely acknowledging we're not together. You've got to do what you can do in the room by yourself. Absolutely separate.
Exactly. So the telesimulation, the think out loud is a perfect piece of advice. It's almost like giving a dictation of what you're doing.
Mm-hmm.
So
like
I'm coming in the room, I'm going to close the door behind us, whatever, the kinds of things that you would do in your life.
Very neat. What are some other TeleSim opportunities that you can think about for our students, especially as we're moving forward in trying this with them in the curriculum right now?
So it's really exciting. So we at SAIL have broad capacity to reproduce the human-based simulation experiences through telesimulation. And we have the capacity to actually reproduce technology-based simulation. So that's to say like the mannequin-based simulation experiences as a telesimulation experience. And what's really exciting about that is, in this case, everybody, including the techs, are participating remotely and safely from home. As opposed to some centers that are still having staff come in to the center to work with the mannequins and the learners are zooming in, we made a safety decision that everybody should be from home. And the experiences have been pretty compelling so far.
It's hard. I feel like a lot of creativity had to go into making this happen in the pandemic era right now. but I think it opens a lot of new opportunities within simulation too. And it's exciting that our students are going to get the benefit of that right now.
Yeah, definitely. And there have been some unintended benefits as well. So the first pilot we ran of the mannequin-based telesimulation, the importance of closed loop communication and using people's names was made it was even more highlighted
Mhm.
because the learners actually couldn't make physical eye contact with each other. And so they had to say, Joe, do you need me to switch out chest compressions or whatever? And they
Wow.
spontaneously brought that up themselves. So that was really cool.
So much that we've all learned from the Zoom platforms and WebEx platforms in terms of how we need to communicate will translate back to in-person communication too, I hope. So,
Exactly. I think so too.
well, Dr. Park, thank you again for taking the time. I know you have a busy day, so I really appreciate it, and our students will as well.
Thank you, Dr. G. See you later.
See you later.